Daniel ready, and I'll be reviewing CSF Overdrainage and Shunted Intracranial Arachnoid Cysts, a series and review. This paper mainly deals with three different types of complications that can occur after the shunting of patients who have been diagnosed with arachnoid cysts. Now, just to provide some background for you guys, I'm going to go over some material that'll help everyone understand what exactly I'm talking about. First of all, here we've got a diagram of the ventricles located in the brain, and the arachnoid cyst can block one of these ventricles and cause a condition known as hydrocephalus, which is the backup of cerebral spinal fluid in the brain. This can cause swelling and severe neurological problems in children and adults. The majority of hydrocephalus cases, especially due to an arachnoid cyst, do occur in children, so there's an even greater danger of neurological impairment along the road. So next I'm going to show you a CT scan of an arachnoid cyst. Here you can see it circled in red. It shows up pretty easily in neurological exams and radiological exams. Now, the arachnoid cyst develops from a layer of tissue in the brain called the arachnoid membrane. Here is a nice little diagram from Dr. Potter's slides, and so you can see here that the arachnoid membrane is integral to the protection of the brain. So having a lesion here can cause severe problems. So this paper is pretty recent. Like I said, it's going to cover three conditions that can occur due to overdrainage of cerebral spinal fluid due to shunting. So the first, and I think probably one of the most startling problems that can happen, is called Chiari-1 malformation. Now this is very new research because it was previously thought that Chiari was genetic, and so finding out that the overdrainage of cerebral spinal fluid could cause Chiari syndrome is, well, pretty huge. So next I'm going to show you a picture. This is an illustration of what happens during Chiari-1 syndrome. It's probably pretty hard to see, but pretty much it involves the cerebellum pretty much kind of dropping into the brainstem area. And this causes a lot of neurological development problems, specifically involving balance. You can have nausea, vomiting, headaches that start in the back of the neck and move up. It can be very debilitating. It's really of best interest to avoid overdrainage. So next we have a condition known as slit ventricle syndrome. And this is also a very, very tricky sickness to track down. So most of the time, hydrocephalus is going to, if a patient comes in with hydrocephalus, they've got swelling of the ventricles, and this can be easily seen on a CT or MRI scan. So the neurosurgeon will decide whether he can safely remove the arachnoid cyst or if the cerebral spinal fluid needs to be directed away from the ventricle that's being blocked. And if this is the case, then you'll have a shunt implanted, which is a major cranial operation. So a lot of risks inherent with that. But, okay, so then they'll follow up to see if the shunting's successful. They'll take another MRI or CT scan, and they'll look to see if the ventricles have shrunk. Usually, doctors will write this off as, okay, we were successful. Now, the problem is with slit ventricles is after a child gets older, the ventricles can begin to harden and stay in this very small, compact way. Now, I showed you a slide previously that shows what the ventricles should look like. Now, this is a scan of someone with slit ventricles. And if you can tell, there's really those are tiny. That's much, much smaller than they can be. And this leads to several neurological problems that can appear pretty much out of nowhere. You're looking at severe headaches, nausea, vomiting, lethargy. And the thing is it can be very, very hard to diagnose this particular problem because that can also happen in a normal shunt malfunction, such as infection or blockage. So that's very, very problematic if your shunt is causing these kinds of problems. Now, the authors of this paper suggested, first of all, wherever you can, avoid shunting, because no matter how good you are, how well you think that you need to drain, if you have either of these two symptoms, as well as peritoneal fossa overcrowding, which I couldn't find very much information on, but is very similar to Chiari-1 malformation, you're going to have to go in, you're going to have to perform another surgery, you're going to have to change the shunt, and this can just, again, it leaves the patient at risk for infection and all sorts of complications. So they've suggested, like I said, to avoid shunting where possible, and if it absolutely necessary. Luckily, today we have programmable shunts where you can, without surgery, adjust the amount of cerebral spinal fluid you're draining from the brain. Now here is a good example of a programmable shunt. As you can see, it's pretty complicated here, but you can at least adjust the amount of cerebral spinal fluid that you are draining. So I think this paper was very enlightening. Like I said, it's very recent, and it provides an excellent detail of the types of complications that one might expect from placement of a shunt. And I believe that it's very important that parents, because again, hydrocephalus is mostly present in children, I believe it's very important that parents are made aware of these complications before a shunt is placed. And I say that because shunting is a very common practice among neurosurgeons, especially when faced with children with hydrocephalus, because it, for the most part, alleviates problems, or alleviates the immediate symptoms, and you're not directly performing surgery on the brain. Now, of course, in addition to these complications, there are the normal complications involved with shunting, including infection, blockage, and even more wide-ranging medical problems. All right, and that's been my review, and thank you for watching.